According to the World Health Organization, cardiovascular disease will be the leading cause of death in sub-Saharan Africa by 2025. The Aga Khan Hospital in Nairobi, Kenya benefits from advanced medical technologies to treat these pathologies which have become too frequent. We had met this Center of Excellence and its staff. Take a look.
It's the end of a long night's work for Dr. Jailan and his team at the cardiac surgery unit in Nairobi's Aga Khan Hospital. This is one of the nerve centers of the Aga Khan Development Network, an agency that has been active in East Africa's healthcare sector for many years.
I'm an interventional cardiologist, which means that when people come in and have a heart attack, I can look at the blood vessels that supply blood to the heart, the coronary arteries, and look to see if there are any blockages.
When Dr. Jailan left his practice in England a year ago, he was astonished by what he found in Africa, by the new diseases he saw.
I was astonished to find when I arrived that the prevalence and the extent of coronary artery disease in patients in this part of the world is as severe, if not more severe, than it is in other parts of the world. There are more people getting this condition. It's not that we're better at picking it up, but there are more people getting this condition. And there are lots of reasons why that might happen. The prevalence of diabetes, for instance, in this part of the world is increasing. High blood pressure is a very common condition that affects almost a third of Kenyans above the age of 25.
This private health clinic was founded in 1958 and is now the most respected in Nairobi. In another wing of the hospital, Dr. Makumi treats another disease that is relatively new to Africa. With the changes in lifestyle and growing industrial pollution, there has been a steady growth in the number of cancers. In Kenya, there are 20,000 deaths per year and 28,000 new cases.
Over the last 2 decades, we have seen an increasing number of cancers in East Africa, which is not limited to East Africa. Basically, it's the entire sub-Saharan Africa region. And we have had projections of up to 70% of new cases globally happening in these parts of the world.
Patients here will often refuse the appropriate treatment out of ignorance of an illness still misunderstood by many.
We have to deal with a lot of patients who want to go and try traditional medicines, herbs and other local medicine, which are not helpful to them. And it's very, very challenging to make people change and understand that maybe they can get good response from chemotherapy or radiotherapy as opposed to traditional medicine.
With less infectious diseases but more cardiovascular diseases and cancers, there has been an added financial burden to bear. As in developed countries, these pathologies are expensive both for hospitals and for patients. The new Aga Khan Center in Nairobi, with its pioneering techniques in cardiology and early screenings for cancers, cost $50 million. It is a daily challenge to find ways of providing cutting-edge treatment without leaving the least privileged behind. The AKDN healthcare system has been present in East Africa for decades. With its 4 hospitals and 66 consultancy clinics, as well as 5 healthcare centers in Tanzania, the network is finding ways to adapt to the changing situation.
In this wide network, we are not integrated, through a coordinated system. So His Highness asked us to come together where he could see one integrated health system across East Africa that would be underpinned by teaching and capacity building, so that we are creating healthcare providers and healthcare professionals that are so much in shortage here, and that we are emulating world standards, internationally best standards. And we are doing research that is relevant to the diseases of this region. And it has to be replicable, and it has to be financially sustainable. So you build systems that have good margins of operation that then can pay for education, can pay for serving the poor. So it's kind of like a Robin Hood.
This approach to healthcare takes account of the patient's plight, focusing on their needs rather than their financial resources.
To reach out to patients most in need, and this allows patients who, for instance, may not be able to afford a certain type of pacemaker, which could be life-changing or in fact life-saving, to apply through the welfare scheme and get access to these treatments. And what I would say is that I've been here for more than a year, and I haven't even had one patient rejected by the welfare scheme.
The increasing popularity of such vast integrated healthcare systems parallels the emergence of an ever more affluent middle class. People that will sooner no longer need to leave the continent to get the right treatment.